Are you just not feeling like yourself? You know, you could have a hormone imbalance. This morning, we have AnnaMarie Cantrell here with us from Renew Health and Wellness to kind of give us some of the warning signs and to tell us how they can help you start feeling better. That sounds great. How are you doing?
I'm well. Thank you so much for having me today.
Yay, we are excited to have you. Let's talk first, before we kind of get into the symptoms and warning signs. How important are hormones to us?
Sure. Well, our hormones are vital to keep in balance. It protects us against osteoporosis, cardiovascular diseases, all types of things. So when we see those deficiencies start to pop up, we can definitely tell a difference if we know what we're looking for.
And that can start happening around like 30, age 30?
Yes, even in our early 20s, we can start to lose our hormones, and as our body makes less and less, and our storehouse kind of just gets drained, and so we'll see that depletion start to happen that early.
So if someone's sitting at home and they're like, how do I know if I'm losing my hormones? It's not like you just see them like fall off your, your skin. When you're like, oh, man, I want some hormones, I need to grab those. But what are some of the warning signs or maybe some symptoms?
Sure. I always start with quality of life. If we start to just not feel like ourselves anymore, energy levels can be depleted. We can see, depression, anxiety, heart palpitations, as well as other physical symptoms, difficulty maintaining weight, intimacy issues, things like that.
So what would you do to fix it? Like, what would, if I'm like, you just named 3 of the things that I'm going through right now, probably should come talk to somebody.
Yes, and so that's what I say, when you start to not feel like you, come see us at Renew. We've got, a free consultation that we offer that we can sit down and kind of go through some of those symptoms, make sure that it is a hormonal imbalance or deficiency. We focus on kind of refilling that well so that our hormones are there for our body when we need them.
And then if you're like, oh yeah, girl, your hormones, they are low, what would we start doing? What would our process be?
So if we move forward with our hormone replacement therapy, it's going to look different for everybody. So we do tailor all of our programs specific to the patient.
Okay, so like me and you would send me something like, this is what we're gonna do, and I could call you and be like, AnnaMarie.
Absolutely, yeah. Just give us a call and we'll kind of go through the symptoms. We'll go through other health history and things like that. We do have a fantastic medical staff in-house on site, so they'll review all of that with you and just make sure that we are. If we don't know where you're at, we don't know how to help. So we always will start with that medical approach. Usually blood work is kind of step one once we decide.
That tells you a lot of things, that blood work. It really do. Besides having years of experience, that kind of really makes a difference when you come to your treatment. What else sets Renew apart?
Sure, yeah. So Renew's been doing this a little over a decade, but we are a practice that really focuses on the total person. So we will go through that health history. We will make sure that we are doing our best to bring your levels back up to that optimum level so you can start to feel like yourself again. We like to, we kind of hold your hand each step of the way because making a change can be a little intimidating sometimes, and just depending on the program that you do, it's going to kind of depend on how much you'll see us and talk to us, but we definitely kind of take that personal one-on-one approach, and that's something we love.
Well, like with spring, it's weird. When it's about to be winter, you're kind of like, you just kind of go into a hibernation. It's almost like we expect to not feel great, but you're like, it's cold. That's what it is.
Right.
With spring, though, you're like, no, things are blooming. I want to feel alive. Do you kind of address that?
We do, yes. So once we kind of have us feeling better from the inside out, we also have a full aesthetics department that we're getting ready to kind of ramp up for that springtime, the springtime things that we want to feel as vibrant. We want to look as vibrant as we feel inside. So, as we've gotten to a point where a lot of our patients are starting to feel like themselves again, they have the energy, we want to go out and do things and be seen. So our aesthetics department is fantastic. We also have, we participate in the Clean Start weight loss program, and that's basically a 12-week medically monitored weight loss. So if that's something that's concerning to some of our patients, we also offer that.
Yeah, that all kind of thing. Any other new services or products that you want our viewers to know about?
So so April's kind of aesthetics, right?
Yes.
So we do focus on replenishing, rejuvenating, all these things inside out. We offer everything from dermaplaning to Botox, along with the weight loss and other things like that. So definitely something worth checking out. We have Facebook, we have Instagram. So if you keep a pulse on that, you'll know exactly what we've got going on for April. But there are some exciting aesthetics coming up.
That sounds great. AnnaMarie, where are y'all located?
We are at 526 Howell Road here in Greenville. Pretty easy to get to, but you can always just give us a call.
Sounds great. You'll see all the information on your screen. Call them, go get your consultation, and let's rock out spring. Sounds good to me.
Absolutely. Me too, right?
Yes, thanks, girl.
Thank you so much.